Once you get your health in order, then you can reach out to the people around you and be a better friend, a better husband, a better member of society. I don't think you want to spend the end of your life in a hospital either, though. Most people think that great care costs more. In fact, it doesn't. Great care costs less. Let me give you an example using outpatient surgery. It's the simplest example. With outpatient surgery, we measure not only what goes on the day of the surgery, but we measure all medical costs from the day of surgery to 7 days after. That's how we know that great care costs less. You cannot be a low-cost surgery center and be poor quality, because the costs will show up in those 7 days after surgery, and they'll show up as transfusions, admissions to the hospital, wound infections, all kinds of other things that you don't want to have happen. So that's what drives up the cost. Wellbridge, our partner, makes sure that those things don't happen. And as a result, they're the lowest cost surgery center around. We save substantial amounts of money for people by focusing on quality. We were able to show for our larger clients, several $1 million in savings, and for everybody, the savings are substantial. So when you think about that, the value of quality becomes really obvious to people. If you're looking at your healthcare costs going up, it's not because care costs more. It's because poor quality care costs you twice. The GLP-1 program is one where the person comes in, they get a band, they get an app that allows them to highlight their nutrition, and they start on that at the same time that they start the GLP-1. If they don't get the steps in, if their food intake is non-nutritious stuff, then they don't get the GLP-1 the next month. You have to use it according to the way it was approved. So it means following a diet and exercising in addition to taking it. And so you control compliance in that case by just saying, no, you're misusing the drug. It wasn't approved for the way you're using it. It's dangerous for you to continue. We won't do it. And so then if they follow their diet and exercise program for the next month, then they can get back on it. But you hold people accountable for at least complying with the indications for the drug. When you weight cycle, you lose about 3 years of muscle. Not 3 years. You lose about 12 years of muscle. So cycling like that is equivalent to like 15 years of aging on your muscle mass. It's terrible for you, right? Yeah. And people who cycle a lot essentially become frail. They don't have enough muscle to navigate the world around them, and they don't have enough metabolism to be able to eat anything. The older you get, the more problem you have with muscle. I don't think it's really controversial anymore. You also take creatine. There's this guy, Kotlik, I think is his name. He's written several books on superhuman performance. Yeah. And the one that I read that I liked was called The Art of the Impossible. Okay. And it was how do people do things that, everybody said was impossible. And, the answer is that they don't necessarily, just keep focused on that all the time, but it is always in the back of their mind. And so they're doing the things they need to do, to get to that level of performance. If you look at your health status, there's a number of things that contribute to that. All of healthcare, all the healthcare you receive is responsible for about 11% of your health status. 40% are the behavior decisions that you make. I mean, fundamentally, we can't afford the healthcare system we have. We have to have a new one. Yeah, outside in. It can't be disrupted from the inside, because the inside is all the forces are against you. The food industry doesn't want you to eat healthy. They just want you to consume a lot of what they make. It's amazing to me, you go to a grocery and you walk down the aisles, and many of the aisles have no food in them. They just have processed crap. It's amazing how much creatine matters in both brain activity and muscle building. I'm 73 years old. I've been stuck on 12 to 14 pull-ups for years. I started taking creatine. Now I'm doing 17, and it was a month. It's huge, because this is total body weight, right? And it makes a tremendous difference. Yeah, the number one thing you can do for mental health is exercise. The two mental health disorders that most plague us are anxiety and depression. Some people have other things too, schizophrenia and things like that are, really structural. But if you look at anxiety and depression, the exercise is more effective than any of the antidepressants that we have. And it's free. People take more medicine today than they did 50 years ago, but I don't see, a lot of healthy people running around because of it. The easy choice for the doctor, it gives you something and you leave, and they've got another office visit and they can go on to the next one. 30 days. That's the other thing. The healthcare system determines its own demand. It's one of the few industries that can control demand. Automobile industry doesn't control how many cars you buy. Right. The healthcare industry determines how many services you get. See you in a month. And you think about that and you think that's just against all economic principles. That should be your question. Well, see me in 8 months. Why? There aren't really very many bad people in healthcare. There are a bunch of wonderful people. It's not the people that are the problem, it's the system. The system doesn't allow the people to be successful. And you get in there and the grind, and it's hard, A lot of people don't do right is listening. If you go to see a physician and they say, "What are you here for?" On average, 21 seconds in, the physician has already interrupted you. If you just ask them, "Tell me why you're here today," and be quiet, you'll get a ton more information, and it'll take 3 minutes versus the back and forth, which is laden with cognitive bias and all kinds of things that keep you from getting the right diagnosis. You just have to sit there and listen. One of the guys who was, I had many mentors. One physician told me, he says, if you just be quiet and listen, they'll tell you what's wrong with them. You don't have to figure it out. And I think that's true. Our first customer is already seeing the benefits. There's all kinds of tools for changing people's behavior. And, what we're trying to do is pick amongst the tools and then pick from those the application of them. So, what is the most successful behavior modification strategy today is something called functional imagery training. And we use that. It's foundational. But we also use education, which is necessary but not sufficient, telling you that you need to do something. And here's why. It's not a very effective way to change behavior, but you got to tell people that. Memes are great because they just get right in there and they sneak in underneath all your defenses and stuff. You have to have a bunch of tools at your disposal in order to really get behavior change. AI, it turns out, is going to be very good at behavior change. It convinces people more than individuals. If you there was a study done on Change My Mind, which is a Reddit forum, and it was an unapproved study, and the University of Switzerland did it. They got in trouble, but they put AI bots on there to change people's mind, and they were like 80% more effective than humans. The other thing, one of the people's biggest anxieties um, are social anxieties, fear of rejection or fear of talking in public, and it's a big one. These kinds of things, and you wonder, why would we grow up as a species with that as a primary fear? Well, the reason is, if you think about it, 5,000 years ago or 10,000 years ago, if your group exiled you, didn't want you anymore, you were going to die, because we can't humans don't individually do very well in the wilderness. So that's why it's there. And people will say, well, but modern society is taking care of that. It hasn't. And that's the guy who wrote the book I was telling you about. He made that statement in there, and I thought, you're a smart guy, but you got this wrong. Because what happens to people who don't have a lot of close relationships is they die sooner, but they die more slowly. Instead of getting eaten by a predator, they they tear themselves apart. And not having, three close friends has the same risk as smoking 15 cigarettes a day. So all the stuff that we've been afraid of, there's a reason we were wired that way. Our med adherence program, when somebody isn't taking their medicine, we call them, and I mean the AI does, and says, "Hey, notice you haven't taken your medicine. Why is that?" Most programs have just put in reminders. But think about this. If you can't afford your medicine, or if it's making you sick, and somebody's reminding you to take it, that's worse than no no reminders at all. You got to find out why they're not taking it. And if it's a cost issue, there's solutions for that. Yeah. But you identify the problem first. That's what we found early on when we were doing the med adherence thing. I think about this all the time.